One of the very common question being asked in the exam, what may be the complications of hypothermia during anesthesia and surgery? As we've discussed, heat loss is quite common during the surgery because of exposure, because of the different mechanism, and that leads to hypothermia. Whenever they ask the question about what may be possible complications of hypothermia, as for all the examination, it's always better to classify the complications based on the system. It's a quite common quotation during the exam. They say classify or die. So first possible system should be involved will be cardiovascular system, and most common cardiovascular complications are arrhythmias, myocardial depression, it can also lead to peripheral vasoconstriction. Coming to the respiratory system, it can cause hyperventilation, which will lead to respiratory alkalosis, which will ultimately lead to left shift of oxygen dissociation curve. That means it will increase the affinity of oxygen to the hemoglobin. Third system will be involved will be hematological system, and it will lead to coagulopathy and high risk of bleeding. So we have to take care for that. We have to understand that patient may start bleeding after developing hypothermia, even especially if the surgery is going on. Hypothermia is direct CNS depressant and kind of cerebral protective, and it causes brain protection. In the renal system, it in hypothermia you will get increase in renal blood flow leading to diuresis. Many times you will notice that during surgery patient land in diuresis, probably because of lots of fluid being given along with hypothermia which is been developing. In case of GI, it causes impairment of liver function. It can lead to pancreatitis, and it can also lead to ileus. While in terms of metabolism, it will lead to increase in metabolic activity in initial phase due to shivering, but ultimately there will be decrease in metabolic activity which will further aggravate hypothermia. So it will further lead to low temperature or hypothermia. So if you classify and remember the complication of hypothermia like this, it will be easier to reproduce in the exam. Thank you very much. See you later.